We think it would be foolish to build a building without considering sound. It makes no sense to us. The value of a quiet facility to us is huge. There are some things about noise in hospitals that are scary. You know, it's not just about decreasing the noise so a patient can sleep or can rest. Many of the noises we produce in healthcare are scary noises. You know, things like describing a patient to their physician and how their health has deteriorated. Somebody's hemoglobin's dropped, they started to bleed, you've called a code. Those kinds of things are really disturbing to patients. There were many features that we thought were important to help create a quiet environment. Certainly a central feature was a much smaller nurses station. Instead of having one large nurses station to serve the whole unit, we have smaller nurses stations where fewer people gather. This is a simple fact. When you have 8 people at a nurses station, it's a noisy place. When you have 2 people at a nurses station, it tends to be a very quiet place.
We have 4 nurses stations instead of the 1 nurses station that we initially had. So this allows for so many staff members at each nurses station. That alone allows for decreased noise levels. So patients do not hear numerous staff members outside talking and, you know, the workflow that goes on at night. They just don't hear everything that's happening.
Putting carpet down was probably the most controversial of the things that we did to try to create a quiet environment. There were those that said we want tile floors so we can easily wipe up a stain. We did a fair amount of study on that and thought we could create a clean environment, but most importantly with a carpet, create a very quiet environment. The central core is designed where all the backstage functions in a hospital, moving supplies and food trays and whatnot, are removed from the patient's line of sight.
Having a quieter environment is just a decreased stress level on everyone's part. If it's loud and it's hectic, and then it just creates chaos. So just the noise levels being reduced creates a calm, healing environment.
Well, the quiet environment obviously does more than just enhance the patient experience. It also creates a quiet staff. We have noticed a significant difference in the way the staff behave in a quiet environment.
A healing environment and a quiet environment not only helps the patient, but it also helps the associates be able to focus and clearly do their job and be able to think through exactly everything that's happening.
For us, we hoped we designed a quiet environment. But you don't know that until it's done. You don't know that until you're living and working in that space. And so it was very important to us to have post-construction measurements that said, how well did we do? Did we make a quieter environment, and how much quieter?
One of the things that we ask on our daily patient rounds, because we round on patients daily, is were they able to get a good night's rest? It's great to hear the feedback from patients that they were able to sleep at night and they received so many hours of uninterrupted sleep. That alone leads to a healing environment. So our patient satisfaction scores have increased significantly as related to noise in and around the rooms.
Certainly our response has been overwhelmingly positive. Rarely a day goes by that I don't get a thank you from a patient that says, we really appreciate, my family and I, how you've designed this space around patients.